morning, I'm Lori Pounder, your host for Moms Every Day. And this morning I have Dr. Molly Gonzalez from Molly Gonzalez Dentistry for Children, and I always love having you on. Good morning.
Thank you, Lori. It's good to be here. Yeah.
So I want to ask you if you could describe to me tongue and lip tie.
Yes. Tongue and lip tie would be any restrictions that would not allow the lip to flange properly or the tongue to rise properly in order for an infant to breastfeed.
Is there an emotional side of this?
Oh, for sure. I mean, emotionally it can be really hard if you can't breastfeed initially with your baby. It's that great bonding, that time that mother and baby connections are made. Babies can lose weight if they're not feeding enough. Volume of milk supply from mother can go down. It's just a really frustrating experience for both mother and baby.
I know that you see infants routinely for this exact issue in your office. How do you go about treating that?
Basically, we want to see the infant to examine what the restrictions may or may not be. If we find that there is a lip or a tongue tie, we can address that. We have parents swaddle the child. We take the child and get photographs of the frenums and then laser the tissue to open the release.
What are some of the risks that are associated with the release?
Not seeing immediate results, bleeding, some pain following the procedure, knowing that you have to do exercises for up to 3 weeks in order to make sure that the tissues do not reattach and cause the tie to reoccur.
What are some of the short-term and long-term benefits of having this treatment?
The benefits short-term, once the healing does start, which is usually within a week of the procedure and can go up to 3 weeks to a month, where you'll really start to see an improved latch, better volume of breastfeeding, an improved experience for the mom and the baby. Long-term, of course, is phenomenal, and the fact that we see a better jaw alignment for the babies, less need for braces hopefully down the road, also just better breathing, better speaking, swallowing, less social implications. When you're speaking in public, you're not spitting spit or food at someone. You're able to move your mouth simultaneously and systematically and symmetrically.
Do you have a recent example of a patient that you've seen and treated for this?
Yes. In fact, we just had a 3-year-old who came in, and about 6 months ago we released a tongue tie. The other day we saw him. We were talking about the benefits. The short term were better speech and swallowing, but long term we had noticed within the last 6 months his complete underbite had completely gone away, with the tongue rising up against the palate where it should be with swallowing. It was able to start forcing the teeth, the posterior teeth and the anterior teeth, out beyond the baby teeth on the bottom jaw, so that there was no further crossbite at all. It was a complete, nice, symmetrical alignment of his teeth. It was great, yeah, and it should save parents a lot of money in the future, we're hoping. So
great, thank you so much for joining us. We appreciate it. For more information, go to fox28spokane.com and look for your Moms Every Day tab.